Welcome to the program. While disgraced surgeon Jayant Patel awaits sentence and contemplates a life in prison, those in the judicial and political systems have been pondering the implications of his conviction on 3 counts of manslaughter and 1 of grievous bodily harm. The Queensland Government says tighter checks on overseas trained staff and greater public scrutiny of medical professionals have ensured a Patel-style case shouldn't happen again. But Patel's conviction has also left surgeons in the state in uncharted legal waters. John Taylor reports from Brisbane.
From high calling to convicted criminal. Dr. Jayant Patel was supposed to be a healer, but a jury has declared him a killer.
It's vindication and it's relief, but the price that you have to pay is too great, and we shouldn't have to do that.
I'm so happy it's all over. It's all, oh, it's over.
Jayant Patel is behind bars today because we live in a society that is equipped with a fair and just legal system.
These were Dr. Jayant Patel's last moments of freedom as he walked into the Brisbane Supreme Court. Hundreds of kilometres away in Bundaberg, former patients were also entering court to watch a live feed of the jury's verdict. Dr. Patel was guilty of the manslaughter of 3 patients and the grievous bodily harm of another.
Life. He's taken so many lives, so therefore he has to pay with his own life.
Meant so much to this town.
We've all suffered, and it should never have gone on.
There was no sympathy from Ian Vowles. Patel left him an invalid after wrongly removing his healthy bowel.
I'd just like to ask him why he done it when there was no need to, sort of thing, you know. It's like he's buggered up my life for no reason. Didn't have to do it, the operation at all.
Mrs. Patel, any comments at all about the conviction of your husband? Dr. Patel's wife said nothing as she left court with her lawyers, as her husband spent his first night behind bars. It was a landmark verdict in a long and sorry saga. In 2003, 60-year-old Dr. Jayant Patel came from America to be the Director of Surgery at the Bundaberg Base Hospital. His arrival was met with relief by Queensland Health, which for the better part of a year had been unable to fill the position. He was a doctor with a prodigious work ethic who cut through long waiting lists and generated more funds for the hospital. But his 2 years were marked by complaints, controversy and death.
We'd taken to hiding patients. We'd taken to telling patients that they should ask to be transferred to Brisbane. We were doing all sorts of things which really we shouldn't have been doing.
Concern over his conduct came to public notice after intensive care nurse Tony Hoffman blew the whistle to her local politician.
Rob Messenger used parliamentary privilege to say 14 patients at the Bundaberg Base Hospital suffered serious complications after being treated by the surgeon.
Within weeks, the surgeon resigned, with Queensland Health paying for his one-way business class ticket home to the US. It's been a long road to justice for his patients. There's been a wider health system review, 2 commissions of inquiry and a lengthy extradition process. The 2005 Davies Commission found an unacceptable level of care in at least 13 deaths, but Patel would only face trial on 4 charges. For the woman who stood up and risked her own career, Tony Hoffman, Patel's conviction was bittersweet.
There's a lot of patients that we haven't heard anything about that have died and that have suffered because of this man all over the world. And this is a message to dodgy doctors everywhere. You know, that people are going to hold other people, not just dodgy doctors, anybody, accountable for your actions.
Queensland's health system allowed Dr. Patel to pick up a scalpel, despite his past record in the United States. He'd been found grossly negligent and his ability to perform major surgeries was constrained. But in Queensland, he was allowed to operate unhindered. Authorities say lessons have been learned and changes have been made.
It should never happen again. What you do in a health system with 50,000 occasions of patient service every day, you do acknowledge that there may be mistakes, but they need to be acted on immediately. What happened with Patel is that people raised issues and they weren't acted on, and that is the real concern about that.
So registration systems have changed, reporting systems within the health system have changed, and observation of surgical meetings have changed so that we report incidents when they occur and we learn from them. So Queensland Health has changed.
The Patel saga brought into the spotlight the reliance of Australia's health system on overseas trained doctors. Altogether, it's thought about 1 in 3 doctors have been trained overseas, and for some, Patel's negligence has cast an enormous slur over all their reputations.
Clearly, the factors that led to this situation were clearly related to system failures, to failure of the system overall to protect the Australian public. It had nothing to do with the quality of overseas trained doctors.
The Patel case has also raised another thorny issue, that of medical legal liability. His conviction for medical criminal negligence was unprecedented, and his defence is already preparing an appeal. Law professor Heather Douglas says the judge in the Patel case interpreted the criminal code more broadly than it has been in the past.
Potentially, it could make more doctors criminally liable. I should say, though, that it's still a gross negligence test. So even though it's a broader set of actions or activities that might be captured, it's still a gross negligence test, which is quite a high level of negligence that has to be satisfied, or the jury has to be satisfied of beyond a reasonable doubt.
But the medical legal system is in uncharted waters, and legal argument will likely go all the way to the High Court.
We don't want to get to the situation where doctors are not prepared to operate because of the risk of criminalisation. So we need to be careful. Medical negligence has always treaded a fine line. We as a community need to put up with the accidental slip.
The doctors should stay calm. This is an extraordinary case and it needs to play through the legal system to get to the end. It does have wide implications, but as long as we're practising good medicine and we're informing our patients, we're well trained and well supervised, we're safe.